Morning, everyone.
Good morning, Tony and Heather.
Good morning.
Good morning.
Good morning.
Is this yours?
Yeah, absolutely.
Alright. Here's another committee member. Oh, thank you. Oh, nice.
Yeah, right. Put in your collection.
Yeah. I think I still have one or two in your faces, or ones. That's the last pure silver one.
Is that right? I didn't know.
Yeah. Alright.
Well, good morning, everyone.
Good morning. Did everybody sign in yet?
Are we met?
Did you sign in? Four people and two signatures, alright.
Yeah, I'll bring that. I have in the bedroom now. I think they're right.
Yes, oh, no, that's here.
Who's that big homemaker who pushed?
Women.
Was in jail for, oh, you said I love this.
Oh, did you?
Yeah, this is her big color, you know, that's how it got me into it. I like this too. Second breakfast.
That's right. Okay, you can.
It's a part, it's half.
Yes. And you are too. Yes. You can, yeah. Okay, then.
Wait, he's a good friend of Charles Short.
Oh, yes.
Okay.
Yes.
Good man.
Well, I got two committee members and I have 1, 2, 3, 4, 5. Yes. Sorry, I have two committee members, 3 of us, okay. I guess we'll get started. We're on, right? We're recording? Okay. Good morning, everyone. My name is Walter T. Alexander. I'm the co-chair of the Senior Action Committee. I'm going to introduce my two committee members who are
Teresa Colton Reagan,
and
Lydia Gerson.
okay, so we can't do a formal call to order because I don't have a quorum and we can't adopt the agenda. But we can get kicking off with how do you pronounce your last name? Yue? Oh, cool. Got it. Miss Kimberly Yue from Medicare for Race Abuse and Resource. It's a long title.
Well,
Okay, so you could speak from there, it's not, unless you wanna get on camera.
Let's see here. Oh, there you go.
Where's the camera pointed to, Kimberly? Actually.
right now with you,
To me?
I think so.
Alright.
I sometimes do this.
Alright.
This is important.
Yes. You guys come with me small.
Thank you. This is good. Thank you. Okay. That's good. We got that. My neighbor. If some of my neighbors needed this, they call your office.
So office, I can drop them off here, I can go to
Okay.
any maintenance centers or homes.
If you could drop off here when you have a chance.
Yeah.
I live in town.
Okay, you'll leave me your address in the place. Okay, routed to you.
Okay.
So, who here has gotten some ridiculous phone calls promising you the world? Did you change your insurance?
No, but I do wanna push into Medicare Advantage. That's a whole nother.
Yeah.
Yes, we both city workers.
Don't ever switch.
They were trying to push us into it.
Oh, yeah, people.
And we had 3 lawsuits, we won each of them. Your former mayor took it to court 3 times, you know.
Yeah,
So he
but
finally
Johnny is not being as responsive as he should be about this.
But somebody.
I like
did
it,
a-
but you know.
he did a the WNYC Agents NYC, he did with, what's the name, comes on at 10 o'clock. Anyway, so the mayor. So people are asking questions, they say, well, this is one of the questions they're gonna ask him, because a lot of people are concerned. But he hasn't mentioned anything about that since he's been in office.
But that's right, because you've heard of Marianne Pizzatola, I'm sure. She's
Mhm.
fighting to keep us out of this advantage.
Yeah.
You know, that's the only thing is, why do they have the nerve to call it Medicare at all? When it's just private insurance.
Well, it's not just private insurance, it's that because they're catering to Medicare beneficiaries, they technically, and they're. So, speaking hypothetically speaking, they're abiding by the Medicare rules, that's why they're allowed to do that. So like say here, like 65 and older individuals with disabilities such as ALS and end-stage renal disease, they automatically get Medicare. So if an insurance program is saying they are catering to that group, that is technically Medicare. But does it cover everything that you need all the time? No. Do they follow all the rules as we've seen? No. So that's why, like, to me, when I meet someone who they got to retire from the city, has beautiful insurance, I would shake that person if I hear that they switch, because if you switch, the city can say we won't take you back. And then it's happened to some beneficiaries who didn't understand what was going on. Yeah. So what we're doing right now is we're going on.
Do your thing, I'll come, we're coming
Okay,
back.
okay.
Football game.
So like, I'm here, my name's Kimberly.
Introduce yourself.
Yeah, Kimberly, I'm a farm supply trade, and right now I focus on outreach. In my career, I've seen where a lot of people just don't understand how to access their care or what their rights are. And now we're in a space of fraud being on the rise. It's like, you already don't really know what your services are, and you have someone over here kind of nickel and diming you to take your money. It's not a fun spot to be in when you're like, I just want to take care of my health. So we've been going out to really inform people on, if you're someone that does get Medicare, anytime you go see a doctor, they'll send you an end of a billing statement. I want you to think of it as your receipt. You'd be surprised how many times a clinician or a clinic will add in services. And you were like, I don't recall getting that service. Or they'll use fancy jargon that maybe you're not familiar with. So always, like, when you're going to your doctor, have your own list. They're like, I'm coming here for this. And really check it off and cross-check it with the notes and your receipts. Yeah.
And you're right, Kimberly, because I do make a notation, because I'm methodical in that aspect.
Yeah.
And then I had seen them padding the tabs. Yeah, and I was saying.
And your
"No, they
Medicare is
tell
paid
you
for it.
So to speak on it, if you see it, I was like.
I never even thought about that. I wouldn't
Yeah, I
even put it
wouldn't.
back to some.
Even private insurance, they do it. Like, when they say, oh, we have to do a follow call, but your labs are fine, there's no major issues. So you're billing your Medicare. So where this becomes pretty tricky, like someone who is on an advantage plan. Like I said, they'll promise you the world. But then when they get a bill and that's outside the scope of what they're going to cover, you're now possibly stuck with a bill. So that's why we really are telling people to please check these things. It's really important. And so I'll just go over
I'm
the,
sorry, so when you said if there's a charge, if you see a charge.
yes,
That is in excess of what happened.
Yes.
They're to do what?
so
Go
you
back to
can,
the office?
so usually we'll tell people you can contact the provider and say, hey, I saw a billing that's not making sense. But you also can call Medicare, 1-800-Medicare, and tell us, and we'll follow up with them, because
see.
we're reimbursed.
You have.
Right, yeah, but we don't know it's fraud that took place until you guys let us know. And what reason why it's known is that you even have times where it's identity theft. And you're due for every year, if you're a Medicare beneficiary, you're entitled to your annual physical, 0 cost. Imagine if someone goes in your place, gets all the services they need, you show up on your birthday. Okay, I'm ready to make sure I'm good. And they're like, oh no, you came 3 months ago, like, what are you talking about? I know it sounds ridiculous, but like, you would have received a statement in the mail, you probably like, oh, there's some random letter. No, it would have gone over all the charges that maybe that person did on your behalf. So we're really trying to involve the public essentially on these things. Like, my parents are now aged into Medicare, and so it's very much personal to me, where now I'm like, did you get this? tell them this because like it's really serious. Like my mom, she has diabetes and making sure she gets her medicine. She does, she hates pricking herself. So we have her on I forgot what it's called, but she's on one of the
Sensor.
sensor.
Yeah.
So having her speak with her provider to like do the paperwork, so that's covered annually instead of every single time she gets a refill. So we're here to be there for you with these types of things. Let's say even after this meeting, going over this, you guys have questions, feel free to let me know. I live in Harlem. I may see some of y'all faces in Harlem, so I care to see you all do well. And I'm happy to like always like, I don't have the answers, I'll find someone within my group to get the answers. But no one's received any weird calls.
No,
No.
I I still have a landline that's from Spectrum, so they you can block everything out that you don't want, you know. But the cell phone, T-Mobile blocks a lot of the spam calls out
good.
too, you know.
Good.
So I don't even get them. Sometimes they come through and say this is spam,
Yeah,
and then I don't open it because they come in spam folder. More than likely, I'm not gonna mess with it. So
Yeah.
all right.
we will actually never call you guys.
Oh really?
Yeah.
Yeah.
Unless
That's good to know.
yeah, the only time I've seen where it will cost us if like for people on the Advantage plans, and you could it's weird with the Advantage plans you could change your mind every month. They'll say like, oh, we're gonna give you the food card, and then you change your Advantage plan. But in changing, no, they didn't really do this, and then by changing, they cut out something you needed that you didn't realize. Yes, so that's what I would say, like, it sounds ridiculous, we're regulating, but because we're in regulation, it's from a reactive standpoint.
Yeah.
So this is our time we're trying to be proactive and prevent these things though. But I just want to go over some details about original Medicare. So I guess remember there's 4 parts to Medicare, A, B, C, and D. It's okay if you don't. Alright.
Sure, yeah.
So A is your hospital insurance. So you go into the hospital, you're admitted. Anything that comes out of that is through Medicare Part A. But assuming y'all don't like to go to the hospital. Unless you have to.
Oh, yes, I do.
Then like Medicare Part B is like you go to like your primary care doctor, they have their own clinic, you do your labs, that you'll see that in B. Now C is where you hear the Advantage plans. That's C, and then D, think of drugs, that's traditional Medicare Part B. Yeah, so if you go to the pharmacy and you show them like a red, white, and blue card for Medicare, they know to bill it through B. Yeah. So let's say you all, you guys are admitted to the hospital and they're taking care of there for like a week. They're giving you all your medications or any changes they made. And they're like, all right, you're doing great. We're gonna let you go home and we're gonna send your prescriptions to the pharmacy. It may look weird, but that would now be through D. So this, okay, you're like, cause sometimes it can be a lot, if it's you or a caregiver that's managing it. It's like you're running through the hospital, like, wait, who's doing what, who's doing this? They will transfer it to the pharmacy and that'll be Part D.
I get I'm from CUNY, so I get the D through.
Oh, yeah. This is
So I'm not gonna be dealing with that.
no, that one you won't deal with, but in terms of looking at statements, that's why. It's good to see the distinction, like the hospital has the way they bill it, and then you have your DPN. Now, for Medicare Advantage, they bundle A, B, and D together. And each Advantage plan is different. So I would like to say, read the fine detail and understand it. Who actually understands it until something happens? Like, let's be honest. But it's one of those cases where whatever, like if you're someone that you have diabetes or you're managing cholesterol or whatever other things going on, always look at that if you do consider an Advantage plan and make sure your needs will be taken care of. But otherwise, like when you do in the city, I don't like want to hear you do. It's so that's plan. Like just don't. But in the case you guys do see Medicare fraud or anything like that, you have where you'll report it. So it's this number here, 1-800-Medicare. You'll call us, you let us know, we'll report it. And it's also your opportunity for us to go and look through all the billing to see if there's any other crazy charges. Say, hey, I went here, this doctor it makes sense to me. Or we had one, this is in Queens where, like how we're all meeting here. the doctor who was providing meetups was billing their insurance.
Wow.
Yes. So if you go to an event like this and they say, hey, can I get your Medicare card? And you're not getting health services, I would actually say, no, like, why do you need my card? You're not my doctor. No offense, you're not to me, like, why? But it sounds like an innocent question when they're saying that, and then, no, like, it's not. This person was having meetups every month, yeah, charging their Medicare.
This death for service in all aspects.
Yeah,
Unbelievable.
and we're paying for it, so it's abuse at that point, and it was such that it falls back on the general public, because these are tax dollars.
Taxes, yeah.
So that's why we're saying, like, if we don't know, we just keep thinking, oh, these are services people need and they're using it, but you didn't receive the service, this person just ran off with your money. Not
Do
good.
you catch those folks who prosecute?
Yes, we've actually had them
Okay.
prosecuting,
Yeah.
so we have CPI, they're the ones that they look at the trend.
CPI meaning
I'm sorry.
whatever.
Yeah.
Yeah, okay.
Information for it, but like, they're the ones who catch the weird trends. And then they'll take it over to our Office of General Counsel and OIG, and then they'll go after those groups of people. But do keep in mind that those are long lawsuits, the money's been charged, so now at this point, it's like, what can we do to help people protect themselves from being taken advantage of? Especially like, if people have caregivers who, maybe they're not the ones that manage their healthcare, that person, like, being informed is also important. So yeah, so within the book, you just have information on, to first page here, where's Medicare fraud and a piece here. And one other issue is the medical identity theft. We've seen where some people, maybe they have like family members who take care of their health and stuff like that. They sometimes will either call in for health services or prescription through their family member. So that's why we're really saying, like, be vigilant, and I know these sound ridiculous.
No,
but
this is the world we live in.
yeah,
Wow, but it's like, wow, you know,
I'm worried about people who are cognitively.
yeah, they're, so like, we're saying like even you all here, like, let's say. Maybe when you're sick, having a trusted person, you know, that will do right by you. I
Right.
think is important, like, oh, this is what this looks like, these are my actual healthcare needs. If you ever see anything weird, please let me know, or contact 1-800 Medicare, and we will do our due diligence to follow up on these things. So if you're, the only time you should be showing your Medicare cards is like when you check in at the hospital or the clinic, and they're like, they should have it on file, they can look it up as well. But if you go to maybe a newer clinic and they're looking for it, then you can show it to them, but that, I'd say treat your Medicare card like your social security card. No one should have access to that unless they're your doctor. That's the way I look at it. Like, I don't.
Kimberly, let me ask you, is that why they rearranged the numbers?
Yes.
Stuff on there?
Yeah.
I was saying, it was one time it was just the social security number, correct?
Yeah, there's social security number, there's also the Medicare
Right,
card.
but that's what I'm saying, they had changed.
Yeah, it's like numbers and
Yeah,
letters,
exactly.
because we don't want anyone
Wow.
easy to memorize
Exactly.
your information. Say, oh, I don't have insurance, and then I'll just bill it under my neighbor's
Right,
Medicare.
that's true.
That's some stuff. You have anything to get you one, let's see, it's there. Well. Yeah, it's something. What's that?
I have it.
Yeah, okay, great. Does anyone here have an advantage plan? Or is it people up here?
I do here.
Alright, Amy, sorry, business or anything weird you dealt with, the advantage plan,
Yes.
such as.
They say, first of all, you get these calls that say if you have part A and B and you have Medicare, that you are entitled to certain
Service.
extra money. I can't trust that at all.
You should not, yes.
Okay, but on my Medicare Advantage plan, first of all, my coverage vacillates between Advantage and regular care.
Okay,
But my question is, if I have a Medicare Part A and B,
yes,
am I entitled to the extra coverage or the food card or across the counter needs? Am I entitled to that?
Those, no, the Advantage plan is bundling it and charging to, basically trying to attract certain people. So A and B, yes, everyone's entitled to that. The C and D, really C being Advantage plans, that's where they'll say, oh, we'll promise you $200 on a coffee cart for the next 3 months. But if you don't look at the fine detail, you'll find out that maybe they're not covering certain medications that you need. Yeah.
Question. If I am on, I'm not even sure if I'm on Advantage because they pushed the Advantage. I said, well, which one covers my medication?
Right.
So, I went to have, an examination and a biopsy. And, for the examination for breast, I had that. For the biopsy, they're charging me $60.
Yes.
Does that mean I'm on the Advantage plan or not?
Maybe because they're billing you for the services.
They're billing me.
So with the Advantage plan, sometimes they have their network of doctors. They'll have you go to someone maybe who. They would normally, they're supposed to bill it under Medicare Part B. But because they're giving you these other services, they'll increase your monthly premium or your co-pays for visits. And then contractually, they're shifting the cost onto you for your actual services. So yeah, I would address that.
In other words, they are entitled to shift those costs on me, even though last year, same coverage, I had no copay and no charges for medical, for prescription. Same coverage,
Same plan, same
same
coverage?
plan.
So they changed it.
I don't know what they did, but the same plan this year,
Wow.
they are now, all of a sudden I've got co-pays and when I went to pick up my medication,
Yes.
I pulled out my card and I showed them, I have no copay. And they explained to me that your provider said that you owe them a certain amount of money and they are pulling it from my prescription. Yes,
The
at
provider.
Dwayne Reed, y'all. Yeah.
So, okay, again, is that the contracted pharmacy you're supposed to go to? And that's a weird question, but that's where I guess jokes, cause okay, for the, I know this is a real thing, so for the Advantage plans.
Well,
Someone will say, like I'll use it for example, I have private insurance, they'll say, I must go to CVS. I hate CVS,
mhm.
but I have to go, if I go outside of the CVS, like outside of network, I now have to pay way more money than I would have if I had just gone to where I was supposed to go. So one, I would say check to see which pharmacies you're required to go to.
Okay, so when I vet my plans, because when I was working, I had very good coverage under my job. Okay, and I'm used to all kinds of coverage. But I always make sure that when I get that coverage, that it says that I do not have to do a copay, that I do not have to pay for prescription. And all of a sudden, I'm paying for it. Now, all of a sudden, they're saying, well, and as soon as Trump, and I'm gonna say it says anything, because he is not for the people. They'll add money and take it away as they so please. I want to know who can I speak to that would be absolutely clear about what my coverage is and is not. Because when I check through, when I'm sitting in my home office and I'm vetting what coverage
Yeah.
I'm going to take and not. These are the things I look for. That my primary care physician, who I've had over 45
Yeah,
years.
you wanna stay with that.
So I've had it as such.
Yeah.
So what's going on?
Then what else do we have? A group we have for the SHIP, it's state health insurance programs. They'll come in and comb through what needs you have and which plan made sense, but I don't know yet the specifics of that Advantage plan. That I want where you contact them and they send you the information on what pharmacies will be going to. They should have where it'll let you know if your doctor's in network.
I've already established that my doctor is covered, right?
Okay.
So I'm saying, what's the difference between the Advantage plan?
Yeah,
And the regular plan?
which regular plan, Part D?
Yeah, but, okay,
Regular Medicare.
Regular Medicare.
yeah.
So regular Medicare, it's strict, for Part D, it's strictly prescriptions. They're not gonna give all these extras or food cards or any of those
Like the
things.
advantage.
Yeah, the Advantage plans,
Advantage.
so like Part D, it's like strictly prescriptions, they don't cover dentistry or like optometry. I know people are like, I need glasses, can it cover it? It doesn't, but it's strictly that. The Advantage plans, they add on other things that some people may need. So someone may say like, oh, I need a food card. So they'll advertise a food card, but if you tend to look deeper, maybe certain prescriptions that you're able to get with traditional Part B, it's harder to get with an Advantage plan.
I've had a problem with one particular discovery. Okay, because last time, they're willing to send people to your house.
Yeah, to get your, yeah.
Okay,
Yeah.
they insist upon, sending nurses or, you know, in case you need a home health aide, which I don't.
Mhm.
You understand, and I'm terribly, offended by the fact, not because there are people who are my age and even younger that might need that, but when I say I don't want it, I don't want to be harassed. I want you to stop calling me, and they continually call me.
But all these things
And-
are different, right?
All of
And-
them are so different and
Yeah.
they change.
Every year, right?
Every year,
Yeah.
so that's why it's like.
It's very hard to answer this.
Right.
Right, so to me, like, with something like that, I always tell you like, whatever, like,
I'm trying to find the card, because I want you to know who this is, and I think I changed pocketbooks, so now, of course, that's what I get. But basically, what's going on is the same coverage, and one year when I filled out, they sent someone and I allowed them to come so that I could get. Cause it should, so basically, in order for me, because I don't pay money towards, some people pay monthly towards, coverage. But what my Medicare does not cover, that,
no. So the A and B would not cover C or D. C would either bundle everything and have different things they cover, but what they cover varies per plan.
so what can I, and let's make a round in.
Yeah.
So say I still have the coverage, I can always call Social Security and change my coverage.
You
How-
have Social Security, no.
Oh.
Social Security just crunches the numbers to see what you're eligible for.
Right,
Rather it be like, let's say at some of that shares where they get the income driven plan to pay to have assistance. Social Security crunches those numbers and then they tell us and then we do what services.
can I not call Social Security and have part A and B? And get C and D? And get the extra food money, everybody's getting this money, how come I can't get it? That's what I
But
want.
then the trade-off is your services that you actually need, you're paying for.
Right.
So that's why I'm saying like if, when she's like, they're saying, hey, you want this? But your actual health services that you need, you are now being paid, paying $60 a month for 12 months in a year will add up fast. For one prescription.
She can't get off this plant back to.
Oh, no,
You
that's,
can.
that's not what I'm
You
saying.
can, but like you are giving up, you
Yeah.
foregoing all the other perks that are
But
advertised.
the alternative, what happened is this, they made the correction, and so I don't do co-pays. I don't do copay with my doctor, I don't do a copay, now, but if they're saying if I have a specialized. Thing, which was this biopsy that I went for,
Yeah.
okay, so they saying that for that, I must pay. The $60.
Yeah, just for
Or-
usually though, I'm assuming they're putting that under, outside of your baseline needs, specialized care, they'll now start increasing the co-pays. I've seen some of them do that.
Under my coverage, I already have coverage for, dental,
Yeah,
you know, eyes, and all, I'm totally covered. Why? And I do not pay an additional amount of money, like people pay monthly
Yeah,
or
yeah.
annually. So why am I not entitled to the extra money? I'm not getting that part.
Maybe she could ask you this after.
yeah, maybe after, but I'll say for that one, they will, depending on how they classify the care dictates what they're charging it. Yeah, so I get, you're saying, well, why aren't I entitled to this, but if they say, oh, this is beyond. Oh, your regular routine visits, they can now increase the copay or make you go through prior authorization to get like an MRI or something, cause they're saying that's beyond baseline care. So that's what I'm saying, like, if you're staying with the advantage, I'd be very clear about what your needs are, because when the needs start popping up, but they're like, oh, well, we gave you all these others, like perks. This leaves you, to me, it would leave you stranded for actually getting the care you truly need.
So if I have this plan and they pushed for me to be on the Advantage plan, and I said, what's the difference? And I decided to keep my same plan,
Yeah.
which is what I probably did. Then in fact, one time when I signed that paper, it also signed over my food, what I would be eligible. I stopped and read it. And it was in very small print. So I said, no, I'd rather fill this out. And I put it on my computer and I scanned it and enlarged it. And so that it was signing over that over the counter card.
Hmm.
Now, what is that about?
That, I don't know the details of specifically, but I know a regular party, there's no OTC card, there's no perks essentially. But with the advantage plans, think of it like a
Yeah,
gradient
they're playing the
scale,
game.
you play the
Right,
game.
you gotta be aware of what you're in,
Yeah,
what plan you're in, cause they're all different.
Yeah.
They really do,
Right.
and you gotta really
So you
be,
can't speak to any.
No, I-
individual advantage.
she would have to use her network to
Find
find
out,
out.
yeah. So that's what I say, like,
Yeah.
if it's to protect yourself, I'd say look over, like, let's say
Yeah.
the last 5 years, everything that you know you needed consistently, choose your plan based off of that.
Mhm.
And if there's any extra that pops up during the year, you know that you may be paying into that, but if it's like you keep changing it based off whatever marketing
Management.
pitch or I don't know, the calls,
Yeah,
you may be foregoing your needs being taken care of, and that's the concern we have.
you see, because
I just want her to finish their
Yeah.
presentation.
but I'm just saying a little something.
I'm glad you spoke up.
Okay, yeah.
Hold on a second,
They
back.
are predatory
What, that,
to senior citizens, and in these cases, I have other coverages too that people are asking me. So I'm trying to get the answers for them too.
what I was saying is you came right on top, we was just talking about this.
Okay, I'm sorry, go
You
ahead.
asked who was on advantage, and none of us were.
Yeah.
But then she still has a presentation, so we're gonna do questions after, I got other folks that.
Okay, so have some of you guys created a Medicare.gov account?
I did,
No.
yeah, I did.
What is that?
A Medicare,
Medicare.gov account, you can set up your Medicare.gov account. You can also set up your social security
oh, I
.gov account.
Yeah.
That one, I highly recommend everyone here set that up.
Oh, you mean, oh, yeah, I do.
Online.
Yeah, I do.
Because the reason why I also say this, if someone else sets that up for you,
exactly.
they're locked in, that's it, we can't make duplicate accounts for a person. So have your social security account as well as your Medicare.gov account. For the Medicare.gov account, you can also submit complaints or things you.
You know, that happened
Okay.
too with my mom was in the nursing home. And they had like the financial people having
Yes.
access and changing stuff. I had to literally go in and say, oh, wait a minute, you have access to this like that? How many other people have this nursing home bar knowing their information in it through social security?
And you can
I was
go
like,
after them.
yeah. I said, wow, they can go in and change
Yes.
this, yes, the nursing home.
So
If your
like,
family members are in there, you gotta be very
Yeah.
much aware of that as well.
so for social
Yeah.
security, you aren't even allowed to have an outright proxy. So for instance, let's say someone's calling on behalf of you. They would have to get you on the phone so they can verify it.
But they do it even if they do have a proxy, because it happened. If I didn't catch it, girlfriend would have been, off to another country somewhere.
Yeah,
Yeah.
so
I caught that.
SSA.gov, create your account, Medicare.gov, set up your account.
So what you just mentioned, isn't that in violation of HIPAA?
No,
Why not?
HIPAA protects your patient information between you and the provider in terms of that. But for setting up your Medicare.gov account or SSA.gov account, no.
I'm talking about the whole nursing, what she's just
Yeah,
talked
no,
about,
they have,
changing your information.
That's fraud.
yeah.
Okay.
Yeah.
They access different information depending on the financial part of their stay there. Yeah, they
And
have
they have to
access to
back
that.
their care based on what the your health conditions are.
Can you repeat that?
They have to base that change not just on your finance.
Oh, no, and it's not dealing with the health, I'm dealing with the finance.
Finance, okay, I'm sorry, I misunderstood.
Wait, I'll just hop on here, so, can I just share my screen? Well, let me.
Are we on?
I wanna hop on, but I wanted to know if I have that option too, or.
Yeah.
Okay,
You just have to join.
okay,
You have the link.
I should, I think I have it in the email. That would be-
And then just mute yourself, so.
Oh, yeah, it's the echo part, okay. I will do that. Sorry, they're just swirling. Yeah.
One of us is being
Huh?
video, we're gonna let the building know that I'm in, to watch this.
Oh, yeah. It'll be on YouTube.
No, it's what I'm saying,
Right.
tell them to watch it.
Right now. So, this here is an example of your Medicare summary notice. This is like the receipt you would get in the mail. Now, if you set up an account Medicare.gov, you can opt to say, I wanted to see this digitally,
Yes.
but I like to open it up and go line for line. So this automatically happens, and you would get this in the mail. So when you have your Medicare account, you wanna make sure that's the right address. They send this out pretty quickly from, as soon as your doctor's done seeing you, they do their billing, you'll get this in the mail. So like I said, there's the electronic one you can get, You go back. You don't really have to wait, you can always get access to it, if you need another copy, we'll send it to you via mail as well. We just basically, any way we can get to you, you let us know, we will get it to you.
It's a good question. Now, a lot of folks like, I'm almost, I can't read now.
Yeah.
Like, great, they have like a larger print for.
Yeah, you have
You
to
can request a
yes,
large, okay.
we will
But
accommodate
you can
that.
also enlarge that online.
Yeah,
Oh, okay.
But like,
Yeah, but
whatever
you
one-
get the paper one, like I get the.
you like to read it,
paper.
sit
Yeah,
down,
yeah.
well, we can learn.
I like,
So, the explanation of benefits I mentioned before, this is where it goes into detail. So you see like, oh, your Medicare Part B explanation, it will tell you, hey, this is Medicare Part B, meaning this is like your prescription coverage and like things that expenses you incurred for that month. So it's not a bill, it's just an explanation, right? So both, the Advantage plans and traditional Medicare, they have to provide these, and it gives you the information about what's going on in your care. So, said protecting your personal information here. If you, sorry. If you look here, at the Medicare card example, it like you mentioned earlier, it does have the funny numbers and letters. And below that, it also will show you like for your hospital, Part A, it shows you when you started receiving coverage. So sometimes you may go see a provider and they're like, well, do you actually have it? You're like, bam, I'm legit. You need to take care of me. So you have that there. So any questions about that? No. And consequences, like. It's open and solid. So we have our medical records. One thing that can be tricky in New York, if you're someone that receives care outside of the healthcare system, sometimes you a lot of people will not be having access to your information.
What do you mean outside your door?
So let's say you're someone that, CUNY has their, I think they have like their own hospital system, or am I thinking of?
Hospitals.
I'm thinking of.
I'm retired from care.
Like Verizon, for instance, has an outside.
Like NYU Langone, it's a healthcare system. So you get all your care within their system, but if, let's say, your primary care doctor, it's like, I don't know, in Washington Heights, yeah, and then your dentist is over here and here.
Oh.
You have multiple opportunities for someone to like either accidentally mess up their health information, or sometimes you'll see, doctors are retiring and some will buy over their clinic and they may digitize it, so just some things to.
And this one, your faculties are going down.
Well, these are things that I've had.
New York Healthcare Act, New York Healthcare Act.
Well, one day. But you could be charged with healthcare fraud if you are just like, oh yeah, Billy, whatever, I don't care, it's not. Like, we all that, that's a no. And we don't want anyone to lose their benefits, that's why we're like putting about that there. So. In the case that maybe your card information is compromised, there have been instances where will place that beneficiary into like a locked-in program where it's like almost like hand locking them while they get services, just so they don't get into trouble then.
We got a lot of hackers now
Yeah.
tapping into people's personal business. I mean, and nobody's safe anymore.
Right. So that's where like, if you see it, like I had one where my dad loves Starbucks. And someone said, oh, we'll give you a $50 gift card. And he took the bait. I was very disappointed. No, we will never free stuff. And no, like, don't. I was like, Dad, you make me look bad. I was like, no. But they appeal to what you like.
Exactly.
So just be mindful of those things. But once again, for the identity theft part, this is when someone has your social security number. Someone stealing your social security card number can do so much damage to you, your finances, your retirement money, even having to get the law enforcement involved and then having to look into it. So protect that, like you, maybe your spouse, maybe a trusted person that like, okay, if my life goes to hell, I need your help, but we won't call you asking for it. So just know it's not us calling, you can hang up immediately. I don't care what type of smooth talking or whatever, no. And that phone call. Now, in the case that it does happen, or someone you know is experiencing it, you of course can visit identitytheft.gov as well as ftc.gov/ID theft. So that's where you call and they'll start the whole process of like, freezing stuff, which it's frustrating. You're trying to fix it, but now they're freezing everything so your money's not disappearing. So the best thing is to just not have it happen to you, but in the case that it does, these are our resources there. Now, medical identity theft.
Oh, well, I didn't.
So
Take out the wrong kidney, whatever.
So when I was saying that when someone maybe goes and receives services with your information, that's not on the record. So you could have accidentally come in thinking, I'm here for this, and it's a follow-up from what care that person had. So that's why any weird, funny business, and it really starts with like the false diagnoses, like where you've never had diabetes a day in your life, and all of a sudden they're like, oh yeah, you
Hit on insulin.
yeah, that's fine. You like let us know so ahead of that. So I know this sounds crazy, but you'd be surprised how many people
That's on Medicare.gov.
Yeah,
Right, started it.
It's 24 hours, right?
yes. 20 times.
So it is.
Mhm.
24/7.
And they do a good job keeping a track record of it. I experienced it myself because I manage my dad's stuff, and he's trying to live his best life in his golden years. So he gave me I can do the paperwork, and he got a letter where they will. I heard they flagged something, but you have 60 days to respond. He was out the country. I called, and when they're like, no, we don't, and I was like, no, I called, and they'll see it, and they honored it and fixed it immediately. So But it really takes you letting them know, and I will give them credit for that, cause I was skeptical, like, how do I know you're gonna actually fix it? They will. And they track when you call, if you even want, you can ask them for a transaction number of the time you called for your own records. And they'll give you that, it's like good. So, here we have our 4 Rs for fighting Medicare fraud, so record your appointment services. Review your services, report suspected fraud, and please remember to protect your personal information. So report, you just.
What if you lose your card? I mean, it's just guard your card. What if somehow by accident, I mean, it's happened, where you get pickpocketed or something? What happens then? What if, did they change the number on the card?
You
or-
can, if it, you can
Oh,
tell
okay.
them, and we've had instances where they'll cancel the card. Which it can be cumbersome, they'll cancel and get you a new one,
Okay.
and then you would just inform your providers that, hey, there was a breach, I do have a new Medicare card number, and give it to them, and you're back to business.
Okay.
So you can always contact us at medicare.gov. And if you do call us to report or make a complaint about fraud, just like when you call us, just give us a provider's name. And like, any identifying information you have on that provider, the date of service, and then your name and Medicare number. The reason we ask for the provider specifically is oftentimes you're not the only person that's happened to. So that way they can start tracking this provider and then be like, you know what we now do is we'll kick them out the network, meaning you're not allowed to.
What if I lose their medical license or something?
That would be feasible.
Oh, baby. But we're just not, you're not allowed to see Medicare beneficiaries.
Can I ask, if you get, what ELB from Medicare, and it's reporting that you had a renal transplant or whatever in Texas, but it's coming to you. So yes,
Immediately.
yes, that's what, yeah, I just got out the bill.
You had a renal transplant in Texas? I'd like to know.
It's Austin, Texas. And they're saying my, copay is X, Y, and Z. That is scary. The fact that they said I had this procedure is what's scary. I just got out the mail. I have to call them. I have to call them.
Call, cause.
No, I am.
Okay. Cause sometimes you can be like, I couldn't be bothered.
Did I?
But what you
In
did.
Texas. A provider in Texas.
Like it's something, I'm actually glad you showed an example.
No, really?
Some
No,
people,
I guess.
some people think it's a joke, but first of all, that's not a cheap procedure. So I'm willing, as in the 15s to
The
20.
copay is $600 and some odd dollars.
Yeah.
Okay, and you only get 20%, right?
So no, report. It's a.
Excuse, well, rather, not as tragic. I need to get my driver's license renewed and I have to get an eye exam, right?
Yeah.
And didn't Medicare used to cover that? Because they're saying they won't take it for that.
I think they
Every place, they changed, well, they said it was changed.
bad, but
I think, all right, because they were telling me it's changed. I mean, I just was curious.
Don't they do that?
Our services,
But you wanna go down there in that mess?
City,
What?
we're city workers. A lot of that stuff comes to our union.
Right.
Oh,
So,
maybe I should call them?
yes, you call the union.
Yeah.
Okay, so you have.
Yeah.
They'll always direct you to where you'll be taken care of. I'll give them that. So,
Okay,
yeah.
all right, good to know.
So in New York, they also have the Senior Medicare Patrol. They're a really good group that goes out and just like educates and combs through on how to really protect seniors who receive Medicare services. So they'll educate people with Medicare on preventing and identifying, reporting healthcare fraud. They love volunteers. I've worked with them. They're really good people, and they're there to hear the complaints. There's no story too crazy for their ears. They want to hear it, and they want to go after some people committing fraud. They're committed to this. One of our retired colleagues, she did 45 years at CMS, and she now volunteers with them. Yeah, she received I think a bill for some heart procedure. She was like, ooh, where? And that's what started this career. And cardiac surgeons make a lot of money. So just like, you know, the type of billing they did, and she was like, I received no such service. I didn't ask for it, and they billed it, processed it. That doctor, the team got their money, and you're like, what is going on? So they sound ridiculous. People who are committing fraud, they're not expecting you guys to do anything about it.
Right, but they think you're sitting on.
Yeah, or you just won't be bothered. You're like,
And let the
I
government
was,
do it.
yeah, exactly. But it's like we are thinking, oh, that was, you know, received.
Oh, it's in here, it's right in your footprint, okay.
we have a couple other people that are interested. Are you finished?
Oh yeah, I'm all set. So this was pretty much gonna be my last stop. There's other stuff, but we talked through it in different points. But
Yeah.
we just want to make sure you're safe. We're receiving Medicare benefits. We do have open enrollment starting October 1st.
Oh, yeah, just wait, sure.
Yeah, that'll be later. So we can go back and we can go over like Medicare basics. So you make sure you're getting all the information you need.
And your recommendation is to stay in traditional.
I don't ever want to do Netflix.
Oh, well,
This we gonna fight.
yeah, I'm not going in any of
Like,
that.
you know, cause
Ralph Davis says I wanted to have.
It's beneficial to call you or call Medicare.
so if it's like more detailed personal questions, of course, Medicare. But
Alright.
if it's like accessing like resources or stuff like that, or
Okay.
like stuff like that,
Okay.
yeah.
Alright.
Alright.
What did Ralph Davis say?
You said.
It's neither Medicare nor Advantage.
Right. Thank you very much for your presentation. It's good stuff, you know. It's good stuff. We'll be back at our resource, our combined resource bid next year, so. I think we should do the, see if we can get to.
So you'll bring some of those to the office, so.
I did, I took some of them. I didn't take it this one.
I know, I took one to the
I took their calendar. All right.
Thank
Because
you.
you're right in front of, that's the camera.
Oh, that's.
Sorry, is that, did you find it Riverside?
Well, I don't want
Come on up.
around.
I left my home,
Come on.
I do. Car.
You lost it.
No, the pharmacist called me.
Oh, that's nice.
Along with your kidney, huh?
No, the problem was, I was on my Girl Scout road, Kiki. So, first, I didn't go in there, so I didn't miss it, and I went. Well.
Okay, you introduce yourself.
Morning, everyone. My name is Wayne Tyree. I am the Director of the Economic Mobility Department for Guided Riverside. We recently, a year ago, were hired to do social services for the Manhattanville 6 buildings there. We have an office on site, and we can only help for the Manhattanville contact people that are on the lease in Manhattanville. We also have another site, our original site, which is on 140th Street, 140 West 140th Street, between Lennox and 7th Avenue, close to 7th Avenue. So anyone that needs services that is not on the Manhattanville lease, we can service them there. And we do the same thing at both sites. Everything that we do is free. We have lawyers that you can meet with, absolutely free. We have we work with what is it? Which guy Santos from? He's from where? Health First Guy.
Health First.
Yeah, Health First. We do benefits. Any benefit that HRA offers, we do. And we do it electronically, so it speeds the time up. We have 5 case managers here at Manhattanville that are speak English, Spanish, and French. We have staff at 140th Street that replicates the same thing, English, Spanish, and French. Any benefit that HRA offers, we go after. And if in fact the case managers are extremely astute at knowing what will get the benefit approved or not. So in fact, the case managers, if they apply and someone's denied, they call it mediate, we mediate it. And they have to show us why that person was denied. And we have a very good track record on mediating cases that were denied. again, it's HRA is the go-to agency in the city. I mean, they have SCREE, which is for senior citizen rent increase exemption, as opposed to freeze your rent for a third of your income. They have DREE, right?
That you mentioned is free right now. The Screen Tree program was just announced from the governor's office. That the eligibility for the screen has increased from $50,000 total family income up to $75,000.
Wow.
Excellent.
Okay, yeah.
That's good.
And in fact, Ron is the outreach worker. I don't know why he's there and I'm here.
Right.
But can I ask? So if you qualify for street or jury, and that's 30%, correct? How would that relate or compare to the, how, what do you call that? Increase every, no. What increases every June 1, the affordable, the increase that the landlord and them negotiate every June 1st.
Oh, your rent increase?
Yes.
Yeah, well, rents stabilization still stays the same.
But I'm
That
saying,
would
compare, no, but I'm saying that won't change,
But
but,
that won't change, it'll still be 30%.
so that's 30%, and so is street, street and grid. Oh, so, okay.
And DREE is disability rent.
Oh, I was,
increase
thank you for
exemption.
saying that, I didn't know what that was, yeah.
So you work with all adults, not just seniors, right?
Anyway,
So here's my question. So the great person decides he wanna drop bombs and stuff on people, so I need extra money to take all of it. So therefore, I'm gonna take it from Medicaid and food stamps. So just yesterday, they started just, that's not the word I want to use, I have to be clear, Karen. So now the people have to work. Or do a volunteer services, or they cut them off. And I don't know if it's I know it's for food stamps, but is it for Medicaid also?
right now, my knowledge is for food stamps, it's called the able-bodied work. AB is a bunch of initials. But the
Right
bottom,
now, it's just for food stamps, so it hasn't gone over to Medicaid.
Okay.
They try.
Yeah,
But
right.
that was years ago, and they had to work to supplement the deficit, so they're just revisiting and bringing it back.
Right.
yeah.
So that's just playing back.
Is that under Clinton, I think?
That, no,
No,
before that,
no,
that's the first thing, yeah. I was going there, that's the WEP program.
Yeah.
Yeah, if you were on welfare, you had to work, X amount of hours and stuff. But what happened was, a lot of times they had jobs, they would come to the center and you would sit there in court, cause if there's no job, then you're exempt. But then all of a sudden, somebody put money into the job, so they started sending people to jobs, so. I went to Wildcat, and Wildcat was fine, because I still got my medical and dental and stuff. But they also gave me a salary, and also that's how I got into the city.
Oh, is that right?
Wildcat's still around. They're still around, yeah. But it's good to know that, cause people don't know, and this tape is gonna go out, so people who
Yeah.
listen to it will get the benefit of knowing that
Very important.
there's help, there's help for them.
And we're
in
able to
God-
go anywhere. I mean, if you have a tenant association in your building,
Yeah.
we're willing to come share what we know.
Oh,
and
good.
invite people.
So you're a nonprofit organization?
Yes, Goddard Riverside, there was a settlement house,
Right.
which started,
135 years ago.
yeah.
Well, nice to say, I don't know,
Yeah.
so I'm asking.
You don't know Goddard?
No, I don't,
Oh, I don't even.
not at all.
Oh,
Obviously, you deal with scree and all the rest of it, but Section 8 or other.
everything.
I didn't know that.
They came to the exec board, and that's why I said maybe you should come to our senior.
Yeah, no,
So
they're
they
gonna-
let us know that they're what kind of services they offer.
And the
But
office
just
is,
piggyback from that.
the office is economic mobility.
No, that's my title, they gave that title to me. I don't know
Okay.
why, but at any rate, the agency is Goddard Riverside. The
Got it.
main office is on Columbus Avenue and 88th Street.
Oh,
All right,
back to the center.
Yeah, and we have a senior center, Goddard, you can come into Goddard in a Head Start program and work your way all the way through to 202 housing, which is senior housing.
Wow.
And we have everything in between. We have programs for people that have access to one diagnosis. We have a program for anyone that has a desire to go to college. It's called Options. Options will find a college and find the money for you to go to that college.
No matter what age?
Hmm?
No matter what age?
Wanna go to college?
Yeah, I want my doctorate.
All right.
What is your funding source? If y'all could do all this great.
Well, it has
Everything is
about-
getting cut, you know?
no, that has it's about 50 different programs under the banner of Gotti Riverside.
Okay.
All type of funding coming through there.
Yeah.
All right, so options, I don't know where they're getting their money from. I know the Department of Economic Mobility. My money's coming to a lot of foundations.
Okay.
We have a contract with New York City Benefits, that they just started, which is good. But then we have, Enterprise Foundation, the Total Fund, we have, and the Total's interested in seniors primarily. I mean, they give us money to work with seniors. So we have this
You
huge,
used to get money from the Robin Hood Foundation.
Why did they stop?
They just shifted their.
they changed their focus
Right.
to children and stuff, but we're going back at it.
Okay, and so no federal, cause they've been cutting.
No, now, I don't have any federal in my little,
Oh, you're.
yeah, the agency, I'm sure has some federal money coming in there, city money coming in as well.
Definitely get donations, I mean,
Everybody.
really good donations.
Well, they don't get taxed, so they can donate. This is another issue though, taxing.
But their jewelry lines actually makes jewelry, and some wealthy who buy those jewelry at really fine prices. I said, what? So you learn something new every day.
Right, right.
Yeah,
You're lucky, right?
exactly.
You're lucky.
Yeah.
But yeah, that's, Goddard overall.
What's the phone number people should call if they're outside of Manhattan, not Manhattanville, the other people? Yes.
The 140th Street.
Yeah,
Both are called the Resource Center, Manhattanville Resource Center and Goddard Resource Center. The
Okay.
number would be 212-234-3481.
You don't have
okay,
to.
one, I'm gonna
I have
repeat.
cards and we have flyers.
Repeat that again, so.
All right, again, you ready?
It's hard.
You
Oh, you have
one,
one flag? That's flag. Okay.
Okay, repeat the number again, so we're going to.
Yeah.
21,
How do you can't hear them. Number
the
is.
number to call is 212.
Okay.
234-3481. 212-234-3481.
Anybody would answer the phone with.
234. 3481. Now, you're in Manhattan?
No,
Oh, okay. No, that's the number for any services outside of Manhattanville. Extension 2100. That's,
Outside of Manhattan.
yes, that's for the 140th Street and the administrative assistant is extension 2100. She will assign whatever the issue is to a case manager.
And this is HRA, essentially HRA related issues that you're talking about now.
Well, yeah, if you apply for a benefit, or if you want to apply for a benefit, if you need to recertify for a benefit. If you want to, you have rental arrears and you need help with trying to apply for a one-shot deal. If you have a need for an attorney, you have anything we do, and all of it's free.
And what was that extension again?
2100.
no, you can't know the exact one, that's what you should. I would love to,
But they coming more uptown now. We
So
have,
you said you was on 88th Street?
the main office is 88th. Right, and Columbus Avenue, but we have a site called Edgecombe on Edgecombe and 141st.
Okay.
We have another one, 140th, between Lennox and 7th, which is the resource center. But above the resource center is housing for people that have special needs. We have a new site that we opened up on 7th Avenue. Right there where McDonald's is, the driveway there, on the other side is a new building there.
Oh, yeah,
We're in that building there.
across the street from the.
We're also, we have another site in Harlem, what about?
Edgecombe and 141st Street.
We have one options, the one I told you about the college, that's on 110, and what's that, 110?
Manhattan.
And Manhattan Avenue, thank you. So more and more programs are coming, through Goddard uptown. But, we could be the linchpin for anything that you need, you can call that number, and we can connect you to where you should go. more than likely we can help because we are a resource center and our thoughts are to be a true resource center, we need to be able to accommodate whatever someone comes in the door with. So if you come in, you need something we don't have, it's our job to find.
That's very good.
And we've been,
And y'all been around for so long and
Yeah.
we just, I know.
Yes, I wanna go back for my master's. They have access to that as well?
yeah, that option, anyone has to decide to go to college, whether you're 18 or 80, you wanna go back to college, you can without. And, but, That- that's all you need.
Yeah, I got my back for science. Yeah, it does, 32, 36, right, so much fun. Yeah.
What else? We help with penalties, we help with, do healthy bucks. Which is what is it, like, instead of salary, you get salary.
No,
Yeah,
$2, $30. We got, we got,
Are we doing healthy bucks this year, Walter?
Huh?
Are we doing healthy bucks?
I did, I sent you all, yeah, I did it already. I just haven't heard from them, there's been somebody
Yeah, we still
mentioned.
wait.
I haven't heard yet, so. But the application is in, I filled it out online, I sent you all that, I did it, so.
What am I leaving out? Anything? No. We just did well, we're gonna work with Walter to not clash. We both did
Exactly.
something on the same day.
Yeah, but it was, we didn't know, I mean,
We didn't know, right?
we always, that was our fourth one. The first one we did here, and then, Columbia was gracious enough to let us use the forum. But it's limited, 'cause we had people that wanna come in, sometimes we have to share tables. And people who need, so when you guys had it, that's for cheap. And y'all had a good turnout, we had a decent turnout, and we also had some of the politicians
Yeah.
there for the subway, our elevator.
But
Yeah.
their resource there was open to all ages,
All
all ages.
right.
It wasn't they had open to.
We'll combine next year.
No, good, but I'm just saying, that's why they had a large crowd.
There was a lot of stuff going on that
Right.
same day.
Right,
Yeah. Right. And like 21 vendors there.
yeah,
And as you said, it was open for the children and on up there.
yeah,
Basically,
that's what we
yeah.
had.
And
y'all had food and stuff too, right?
food. Yeah.
We had donations, we had people that donated, so. But we also have a budget, so we have to buy something, like.
Well, that's why we need to join forces.
Exactly.
You know,
We didn't use hardly any our money this year. Oh, so that's just for,
we can learn from you then.
yes.
No,
Wait a minute, this is just the
that's why
beginning. We're excited. I don't know
we
about
don't
you.
have.
Yeah.
When you could.
It made it work.
Yeah, we make it work.
Exactly.
And I spelled your name wrong, I put Tyne, it's Tyree.
Yes. And let me see. Anything I left out, Ron? Any?
What's your phone, is it okay to give out your phone number?
Sure.
Alright, which is, hold on a second. Go ahead.
It's the same number, 212
Yeah.
234 3481. But my extension is 210.
I got Ron's pop right up.
Right. 2101 would be my direct
2101.
extension. And it rings on my desk and it rings on my cell.
Okay.
We also do the free legal notary services.
Yeah, legal.
That's great to know,
Yeah.
too.
That's good.
And what about housing issues, arrears, possible evictions, and y'all state that stuff off?
That's what we do. I mean, that's our purpose in being invited to Manhattanville. Is management will try to evict out there, we try to keep it out within reason.
Cause I
Now, you're being a
especially
nuisance.
seniors, they should never be trying to.
We get one-shot deals for them, we have many sources for rental agreements.
And what about providing a lawyer to have a court case?
Well, we have, as I said, we got lawyers.
All right.
Three attorneys.
All
We
right,
can meet with, but the housing board has lawyers as well. They can represent, anyone who has to be in the
there's
work.
a lot.
So, housing court.
I know.
Housing
Well,
court.
the COVID knocked everything off track, so I know.
Well, it's the sheriff office would be, but they were representing a lot of people, three attorneys.
And they're overwhelmed.
Yeah.
What's your last name, Mr. Tyne?
TYRE. And my number is 213-234-3481. Extension 2100. I think generic numbers on the flyer as far as the office where you can get my administrative assistant. But I'm sharing my extension. It's the same number. Administrative assistant is 2100.
And where are you
Mine is
located?
2101. I'm all over. I mean, I'm headed to the department, so I'm down at 40th Street. I'm here 3-4 times a day. If this one, that one.
You have an office specific.
Yeah, I have an office in Manhattanville. I also have an office on 140th Street. Right now, they're just building us an office here on 3250 Broadway.
What street is it?
130th.
Okay.
Right here, yeah, they're gonna build, the office is built, we're just waiting to get, I'm not waiting, management is waiting for a C of O. So we can move into it, but if it's there, it will be right down the street, I mean, right down the wall.
Question, since you don't have a office per se right this moment, would you would you consider doing like every 2 months, a visit at a location?
Yeah, that's we came to the pool body. But first, let me get, we do have all. We're just in the pram room at 1430. Manhattanville there, and then we have the office down at 140th Street. But someone asked at the full body meeting if we could come a couple of days a week to do whatever. It would be a staffing thing. We have the staffing, and right now, a lot of people are taking vacation, so we're short staffed. We always gotta have bilingual staff in here,
Right.
people.
But would that be something that you would consider in
Yes,
September?
consider, what site would you like us to come to? 3333?
Maybe once every 2 months or so, and we would have that fixed on the door, that would be available between hours X, Y, and Z.
Yeah, let's work that out.
I
Let's work
sure
that
will.
out. The only thing that I'm thinking now, which is not a hindrance, but the 3333 residents would have to go to 140th Street to get the service.
We have that one, we
No,
have that.
because Manhattanville, we can only service people with leases, and our office, closest office is Manhattanville. But to see the folks, we can see them, service them, do applications on their behalf, but the case managers, I had to bring from 140th to service them.
Until you open up here at 130,
But
right?
we're open now, we just get a new office.
But can we have this conversation?
We sure can.
Okay, thank you.
I run this out, yeah.
Thank you,
yeah.
thank you.
Are you planning on coming to the general board next week?
You invited?
Wow, okay, because I mean, you presented at the exec board, so I thought maybe, you know, it would also, usually that's a precursor that usually come here, and then you go
The
to.
answer is yes.
I'll talk to.
If you let us in, you'll come.
And well, you really can come anyway, because everybody has 3 minutes to address the audience. So
We
the
love
public information session, right?
Yeah.
Yeah,
No, we'll definitely be there.
yeah, so that'd be good, because then we have a larger crowd there, you know, that's everybody, you know, the seniors. I think also.
Yeah.
Thank you.
We'll talk to you about some.
Yeah, please do. Please do.
Okay. Mr.
Excuse me.
You leaving too?
Yes.
What's your card?
Part two. You have part two?
What's going on in George Fruits? Come on up. Come on down. Are you from an agency? Are you?
Morningside Retirement and Health Services.
Would you like to say a few words?
No,
All right, I mean, it's up to you.
good, no, thank
You can let people know what they do. Come on up, let me see. We missed them. These are-
Hi, so my name is Phil Haggis, I'm at the George Bruce Library.
That's what I recognize.
Yeah, is Ron still at MRA?
Yes.
Okay.
I'm on the board there, so I'm here, listening and bring up to date.
Got it. Okay, I need to reach back out.
Okay.
I went over there once to do like a talk about library services, but it was years ago, at this point, so so most of the programs we're offering in June will stay the same as the past. We have computer basics 4 days a week, so if you need help with any computer questions or know somebody who does, you know, I'll share with Walter the calendar and it's also all the programs are on our website too. We have one more acting and theater studies class, this year before it goes on.
What kind of study?
Acting.
Oh, okay, I went to that, I went to that meeting.
Yeah. Actually, I think the one you came to is, we have a short plays program, so a local playwright. Does a series of short plays, and her last one for the season is gonna be June 27th, so it's basically like a theatrical production, but. It's a good time, Sussy Davidson is her name.
What's the time?
3 p.m. on Saturday, June 27th for that one.
That's Pride, everything, it's a Pride weekend, you know?
Oh, yeah.
Yeah, we have, thing in the park over there, the Black Pride, and where the food court used to be under the trestle.
Okay.
Yeah.
We have 2 different reading programs each month. On the second Wednesday of the month, we have what we call open book hour. Neither one is a reading book club in the traditional sense where everybody reads the same book. Instead, we just encourage people who are readers to come and talk about what they've been reading. So it's nice because there's no required reading, but it's also good because you hear about books that wouldn't have been on your radar otherwise. So the first one, the open book hour, is on Wednesday, June 10th at 12:15. So it's the second Wednesday of the month. And then we also have what we call a quiet reading party. It's like the first one, but there's a little bit of time to just get reading done. So if you struggle to set aside time, the quiet reading party is Saturday, June 20th at 2 p.m. The local library is also doing a lot to try to promote to celebrate the 250th anniversary of the library. So we have some free giveaway books. The library just yesterday released a list of 250 titles, kind of reflecting on the anniversary, for all different ages, and we've gotten giveaway copies of books. So we're gonna let the people who attend that quiet reading party on the June 20th be the first to pick. So if you'd like a free book, consider joining us then. What else? Those are kind of the main ones. English conversation, if you know anybody who's trying to improve their English. We have on June 9th and 23rd at 4 o'clock, we have a conversation group. To celebrate the World Cup, we're showing Bend It Like Beckham, a movie that came out a while ago, but it's a good soccer film. That's Saturday, June 13th at 2 o'clock. That's it for the majority.
You're gonna send me the calendar.
I'll do that right now.
And one of the things I wanted to, glad I got Pat and Clotilde on the line. We would taking a consensus, I have to get a consensus from the group. We would like to have our senior meeting back at now, I know you're open till 12, right?
Yeah, yes, it's gonna stick with Tuesdays, it's 12, 11, 6, yeah. The only time we have Friday and Saturday go to the 11, so unless.
No, we're not gonna meet Friday.
That's fine.
I just have to see, because we used to meet at 11 because the seniors would go, to their various, senior center,
Yeah.
To eat.
Right.
Since we're not dealing with that now, I like to get a consensus and see if we can start in September or October. Maybe we'll meet September here in October, we like that, just, and let the community know that's where we're gonna be meeting.
Okay.
And we'll have to go from 12 to 1:30, I guess.
Okay.
But I'll take it up with Victor
Yeah, once.
and somebody at your organization will have to speak to you. Clarence.
Yeah, so Janelle Carter Bowman is the manager, she was probably the manager when you were there, so I guess, been there for a bit.
Okay, so
But yeah, I know that there will, I think we will have to have you fill out an application, but I think that.
Okay.
I'm guessing.
What do you think? I'm asking, what do you think about it?
I agree with that.
Okay, Pat?
It's as long as it's the same schedule.
No, we have to move it the same day, but we have to move it from 12 to 1:30 because they don't open up till 12 o'clock.
To have the.
So you could say yeah and nay, or
That's a day for me.
Okay, that's a nay. Clotilde, what do you think?
Sure, that's what she thinks.
What's your name?
I go with the majority. I'm fine.
No, we have to know because I just got 1 for, 1 against.
Can you repeat, please?
No, we're trying to see if we used to meet at the George Bruce Library on 125th Street before COVID. It's a lot easier for seniors to get to, it's very.
Yes.
But we have to change the time to 12, from 12 to 1:30 instead of 11 to 12:30, because they don't open up until 12 o'clock.
Yes, I'm fine with that. Yes, I will
Okay,
add
so
it.
that's two yes.
Pat Johnson.
Oh, Pat Wadler. Wadler. Let's see, Walter Wadler.
Patricia, what?
Yeah, the W is a Y, yeah. Lydia, what do you say?
All right.
Moving to having meetings at.
That's fine, I have no problem with
Okay,
that.
so that's.
Hello?
Yes,
Hi, you can hear me?
yes, I can.
Great. I will defer to the majority. If it means that we have to have it there so that other people nearby can come, that would be fine. But remember, we also talked about the possibility of going to several centers. So I think if we're going to do it to accommodate one group, we need to accommodate others as well.
That'd be confusing though.
You mean, so meeting there at 12 o'clock and then still going to the centers? Cause we can't do, I don't think we can do the centers at 12 o'clock because they're eating, they're eating.
Okay. Well, you know what? It's fine with me. I'll defer,
All
sure.
right, so like it is kind of, we will just stay here and just do that.
But that's one.
Okay, that's what I'm doing. Oh, I thought we could just be there permanently,
I thought we was doing.
All right.
A rotation.
No, because we used to meet there.
I think everybody's seen it.
Yeah, I thought we would be permanently here. But if you want to bounce around, that's.
I just wanna bounce around, I thought I was gonna have.
No, we still have to balance, it's gonna be an increase.
Anyway.
We got to something increase on, yeah, cause.
It's for one visit.
No, I'm okay with the one visit thing, if you want to do one visit, but it'd be that 12 to 1:30 though. So maybe I'll let you know what we like.
Oh, the friendly amendment was on the table, a friendly amendment was on the table.
Yes, ma'am.
If we can rotate, we can do the every other that we're gonna do at your cruise. Excuse me, you can object, nobody can object or.
I checked.
If we could, if it's gonna be something that we would consider, so we can have the mass people, attend. Why can't we do it every other at George Ruth and use that optional one for the rotations? That's what
Who's just listening to this?
for then.
So John will be here, we'll try to see what we can do for October. Okay. But I guess we should just continue singing meeting here, and then, like you said, we want to branch to the senior center, so. Before I forget, we have the paint sip is Friday.
Yeah, and we have a concert tomorrow.
Tomorrow at the Manhattan School of Music, Harlem School of the Arts.
Yeah.
There's a free concert from 6 to 8.
No, 5:30 to 8:30.
5:30, 8:30.
Doors open at 5.
It's a Wednesday, Wednesday, it's at Harlem School of the Arts from 5:30 to 8:30. Friday, the paint sip is in the afternoon at 3333 at.
At the lower level, Hamilton Library.
And your time,
Times 1 to 3.
and it's $5 donation.
So we need to talk around.
Okay,
You and I.
okay.
Who's sponsoring?
Listen, let's hold on, don't somebody. Thank you. And we have I sent your email about all of the events. We have tickets for June.
June 11th is sold out. I don't know about.
For the
Yeah.
I have only got like 1 or 2.
It's not mandatory.
We never had corn.
You have corn?
No, we never had corn.
Corn where?
No.
No, I know the quorum counts in online, yeah, it doesn't count online. So we do.
They're online, you can.
Do what we
1,
want
2,
to.
3, 4, 5, yeah, 5 now, yes, we do.
So you didn't,
I'm so busy with the great
You were very
presentations. Great presentations,
Yes.
Anyway, thank you.
Thanks for coming.
So I understand there's a hiatus now, so there's reasons. So
It's September. You
oh,
are.
we no more meetings now?
Yeah.
And I would like to, the next time, want to come to your say.
Okay.
Will, thanks for coming.
Thank
All right.
See you tomorrow.
Yes.
Please come. Tomorrow what?
Tomorrow, 3:00.
Uh,
Welcome.
Thank you, thank you.
Bye.
Come back. And I,
Mhm.
you didn't do the and you did, but you did the forum, you didn't do the general board. I mean, the general board.
Where do you need it?
No, but it's in the evening, but we have that's where all the communities come together at the forum, starts at 6:30 to about 9. So it's like public session where everybody has 3 minutes to present, you know. So if you, you don't have to come exactly, but
Days.
it's always the third Thursday.
Third Thursday.
Yes.
6:30.
Yes. At the
But not
forum.
the summer.
And you have my phone number, you have my phone number, right?
Email, but.
Okay,
Forum, third Thursday,
yes,
6:30.
yes,
Okay.
and because you have information and a lot
But
of
not,
people love to
not
hear too.
July and August.
But
not
Not yet, we don't meet again until we off for the summer.
Yeah.
That's it, like teachers, we like the teachers, yeah.
I love that.
I do too, you know.
Nice, beautiful, finally.
Oh, yes, thanks for coming again. Have a good day.
I apologize for your.
It's okay.
We don't accept your apology.
Huh?
That's one
Is it?
You know, I don't count.
I would take a motion to open this to meeting.
I second it.
Okay.
Second.
Second.
1:30.
No, we did, I seconded it.
And a motion to accept the agenda.
I accept it.
31. Okay, the food, the health bucks and applications already submitted. I haven't heard from them, we haven't talked about it, I need to follow up with that. Let's see, what else, we got we got 4 events, I get 10 tickets for both the Yankees and the Mets.
July.
And for some reason, I can't now, Pat, Francina, and who else is on board? Oh, that's right, Crowell, yes. So we have 10 tickets, she said your 10 is already spoken for, right? I have, but you have 10, okay, you have yourself and 9 other people you can bring.
Okay, when is that?
June
What's next to that?
11th is the Mets. We're meeting at 11:45, I think, and we have transportation for buses. He's looking for some people to go by accessory line to the Mets. The July 22nd is for the Yankees, and that is yet to be discussed because it's easy access for transportation.
That's right.
The next thing what was doing, West Harlem.
Tomorrow we're doing the
Walter.
It's
Hold on a second, Cody, 1 second.
Okay.
Good.
the next thing that they are doing is August 27th. Is our barbecue annual picnic that used to be at Randall's Island.
Okay.
We have gotten everything set and permit signed. We're doing it at Riverbank. So therefore, it will be easy access, no bus transportation, financial will be involved. However, the fee for it has not yet been discussed.
Question.
And there's no, there's no open flame, so we can't barbecue.
So there will be no cooking.
Yeah,
No, we have to
oh,
cater.
it won't be
We're gonna have to
cooking.
cater.
We'll be eating, but it won't be no on-site cooking.
Yeah,
But what will it be?
we're not sure yet, that's all, yeah.
But they were clever menu here.
Go tell Dad, what's your question?
Oh, yes. No, I just called because I was afraid that you will shut down the online. Do you have any soccer tickets for New York?
No,
Only
no, that
Only
wasn't given to.
stated. That's the only thing that has been provided.
No,
And it's a committee that decide, we get X, Y, and Z, and we decide, and we're going to do this.
they took about for the FIFA thing. For the
Yes, I'm
FIFA.
talking for the FIFA.
Know that we have an open meeting and we only get what they tell us.
There was a possibility.
They only send bets.
Right. But
Yeah.
FIFA starts in like 2 weeks, so
They only said.
you know, see, I didn't think we would get there, because
That's what it's gonna like, we will be having it as finalized by now.
Yeah,
I think that for futuristic, we should get mixed tickets and that's clear card.
Well, if we, that's doable, but we get.
And no, Scott's in that
Wa-
arena.
Walter, it's Kairos.
And how it's
On
going.
you.
Oh, okay.
It has nothing to do with this
That's
committee.
committee.
Go
Yeah.
ahead, go ahead.
Once we get it, we can bring it back to.
Clotilde, go ahead.
Yes, is there any possibility that we ask?
For FIFA tickets?
Yes, for FIFA
Not
ticket.
at all. Not
Okay.
at all. The mayor gave us, well, you had to call in to get, there was 100 tickets. Plus, actually 100 plus one, but that was done by the city, not by the community board.
Yeah, but the
or
mayor,
what's
I
other parts
think
of
it was,
lives.
don't they were doing a lottery starting on the 31st, selling the tickets for $50?
That's already
That's for
finished now.
FIFA.
They have that
That's for
done that by
FIFA, the World
Saturday.
Cup. That's for
Yeah,
the World Cup. That's not what we're
Yeah,
doing.
right.
no, that's what
Yeah,
I'm
yeah.
talking
The
about. I'm
extra
talking
tickets
about
I
the
hear-
FIFA.
We're not getting,
We're not in that, yeah.
Until they come through, governor's office.
Anyway, I'm interested if there's any FIFA
I
ticket.
can't hear you.
I said I'm
Oh,
interested.
I didn't hear one more time. The train's going by.
I'm interested.
You interested?
Yes, if
interested.
any FIFA tickets available for us.
No, I'm gonna just tell you, don't outright, there's not gonna be tickets available for that.
The
Okay.
community board have to request that at large for the community board, not us specifically as the committee. If the community board is granting X, Y, and Z, they can bring it to the committee and say, we had X, Y, and Z,
Yeah.
and you share it. But we can't request it, your community
And then-
board.
What about you, Patricia? Do you have any?
Oh, I don't have anything to do with FIFA.
I know you have nothing to do, but you may
Yeah.
have received some ticket, extra ticket or complimentary ticket.
And
Thank
on
you.
the north side.
No, because that's not gonna happen. We're not gonna get, cause then there's transportation to the stadium,
No
in Jersey.
No kidding.
And no, that's not doable.
Thank you.
So,
Office, community board, office, have to request those things
and
for their
that should
community
have
board.
been.
In advance, and in advance.
Oh, got it.
Okay, all right, we're done.
So now, okay, so those 3 things, the 4 events that's coming up, I have tickets. So if you like somebody wanna go to the games, baseball games, let me know. And same thing with you, Lydia, so just let me know, I have 10, I think I got 2 people that wanna go to the game.
Okay, but I thought that whenever there's extras, you're supposed to give them back to Mr. Hamer.
Say that, but we get a $20 food voucher at the
24.
place, 24.
Yeah.
And
Yeah.
it was people ate last year, and you can get everything, Frank soda,
That's all I need.
you
Go to the
know,
bankers, go to
Yeah.
Mr. Bankers.
yeah, and get what you want, yeah. It was good, it was good.
Okay, Francina, I have a
Yes, ma'am.
question. Hi, Francina. I'm waiting to find out if I could get extra tickets for the Mets game next week. But it's my understanding that whenever there's extras, we're supposed to give them. It's supposed to be reported to Mr. Hamer, and he makes.
You
So he
got it.
decides. He decides
got
who
it.
gets what.
You got it.
If I can
Okay,
give you
because I'm still
mine,
waiting. I'm still waiting to hear, but I
No.
haven't heard anything yet.
Give it back to him.
Yeah, give it back to Hamer, yeah.
All
Yeah.
all 14 of us.
Yeah.
Oh, I see.
Just like he needs, I need, he got,
Right,
give it back to the source.
right.
And then
Right.
we'll be divided equally.
Right.
Gotcha.
Because I'm
Okay,
also
so
waiting to see.
that's no
I'm also
business.
waiting to see if there's any extra slots for the paint and sip. But I've
Yes,
already
there
paid.
is. Pat,
Yes. Yes.
send me your list. Me and Walter gonna sit here and discuss that right after.
Okay,
this
I've
meeting.
already paid though. I've already paid.
Oh, you sent it to Sal?
I sent it to Zelle, yeah. But what
Okay,
happened
so
was
we should get notification. Pat, we should get notification that your 10 has paid, okay?
okay,
we
so
just
I'll
need the
wait. I'll
list.
wait to hear from you and Mr. Hamer.
No, me and Mr. Walter.
Oh,
That's
okay.
the treasurer.
Treasure.
Do we have old business?
Okay,
No, okay, there's
Yeah.
no business to open.
Okay.
I'll take a motion to.
Adjourn.
Adjourn. Okay.
Second.
So move.
Good to see you, Pat, even though I don't see your face, I have on the
Second.
line.
Oh,
too.
good to see you. Have a
Good to
blessed
see
one,
you.
everybody.
Bye. Have a good
Bye. Have a
Bye.
good week.
Hold 1 second, hold on. I need to hold on.
And come back, Walter.
Yes,
Okay.
That's my bag.
Okay.
We're finished. And